Hello, this is Dr. Do again. This video is still alphabetic list problems on letter T. Today I'm going to talk about the trauma of chronic, which means healing wound either physically or psychologically. So this is basically the chronic trauma. But because when we talk about the trauma, everybody think about the acute injuries. Of course, that is the emergency. So let's just bring up the topic of any associated emergency situation with trauma. The unhealed wound for a long time and changed the nature of the wound. The discharges change the colors, and that is definitely the emergency. Or of course, acute trauma, it's emergency. Psychological trauma, either acute or chronic. If it is a chronic, if it change the thought of mind, and also it's particularly there's a life-threatening thoughts for itself or for the others, that's also emergency. So this is the trauma, the not conventional trauma, just the chronic trauma, either with the wound, you can see it, or without it. So let me just bring up the trauma, like a pathological process for the trauma, how the body, what kind of reactions the body have to this chronic trauma and how it happened. Regardless whether the injury is big or small, or is life-threatening, or it's just the minor injury. So the body physiologically to battle this injury, to try to heal it, right? So through the inflammation process, that is the physiologically wound, okay, how to cover it, how to heal it. Of course, a lot of times depends on the depth of the trauma. If only on the superficial the skin have a strong capacity to repair it without the scar. But if it's deeper, then it will be healed by the fibrosis process. The inflammation I mentioned before of those typical presentations, I'm not going to repeat it. But the purpose for the inflammation is to produce fibers to heal that injuries related to the trauma. Of course, the inflammation have a variety of other purpose to battle the infections or battle the other physiological disorders or abnormalities. But regarding to the trauma, the inflammation is really there to heal it, to produce fiber, to promote either the scar or not scar. So anyway, so this is about the process. In terms of the chronic trauma, in the chronic form, I think I'm mainly referring to those with long-term either comorbidities. If we're talking about the trauma of chronic process in the real wound are healed, usually those people either malnutrition or the wound itself is too large. The area is too large, like a lot of burn, the injury during the wartime, a lot of burns and cover large areas. That is really difficult to heal. And also the comorbidities like diabetes, impaired function of white blood cells to produce the chemicals, or the inflammation cells cannot produce the capacity as a normal person, so then the wounds are healed, particularly diabetes. If you probably in the history, even the kings also had to go through this. If I'm right, Henry VIII has the overweight. I think it's undiagnosed diabetes. A lot of people saying he might be diabetic, and he died because he had the wound, because when he was hunting he was injured and that wound never healed. So this is just the chronic trauma. It's there all the time. And nowadays, even though I think particularly, so if you have diabetes, really the take-home message is to check it frequently. When the small superficial wound, talk to your physician, start to treat, to wound covering with different kind of preferences, depends on your physician, depends on the wound itself, to heal it. and also chronic kidney disease and also chronic liver disease, malnutrition, they all have this impact on the wound healing. So this is about the physiological, the wound, the physical wound is there in the body. In terms of the psychological wound, I think it's depends. I think first of all, who are at the risk of this psychological wound. I think the threshold is varied for different people. Some people are tougher. The threshold might be higher, but some people is kind of not as tough as the others. Really, to have this long-term psychological wound, actually trauma, psychological trauma, especially during the some special event in the lifetime. We all have those special event, special moment, but this is how to heal it. I think the first of all is the time, in time fashion, seeking the advice from your professionals. If there are things going on really severely impact in your life, you think you cannot handle by yourself, talk to the physician, any primary family doctor or the specialist or psychologist or friend or families. That's in the urgent time, has to let it out in the right form, in the right time, with the right view, and listen. And so that's probably one of the best things to do. And also, if you think you're strong enough, you can go through with it, then you just need to seek a strength somewhere, from your hobbies, from your reading or whatever the activities to distract your sad feelings or the trauma, the feelings or the sensations from the trauma. And then I think the risk factors associated with the psychological trauma is to use alcohol or smoking or pick up some other habits. So that's one of the purpose for talking about this video, is to talk to people instead of seeking the other way to alleviate this trauma. In terms of the risk factors, I talk about threshold is one. Also, the family history of depression or psychosis, that's also increase the risk for this psychological trauma. And in terms of the management, like I said, seek the physician, change the cognitive, the view of your point regarding to this event or to this feelings, and also to physical activity. Sometimes a lot of time will promote the healing process for the psychological trauma. And on top of everything, I think to seek your medical attention, either psychologist, psychiatrist, or a physician, to talk it to. They will guide you. They probably have a well-established plan to guide you, to help you, to be with you going through this process, instead of leaving a invisible scar in the mind. And so that's the one of the trauma in chronic form actually is more severe than really the physical trauma. So this is about this video, and I realize I'm not quite medical, just a touch basis and superficial, but just the taking home message is seeking medical attention, regardless of the physical trauma or psychological trauma, with the help from the professionals. So I'm going to stop here, and thank you for watching. I will see you next time.